Hello everyone, welcome to my YouTube channel Pathology Learning. I am Dr. Monica. So today's topic will be on cell injury and necrosis. This is the second part of the video under the series of cell injury. So previously on the previous classes we dealt about the reversible and irreversible cell injury and how it culminated in the forms of cell death like necrosis and apoptosis. So we also saw about the basics of necrosis and apoptosis. In this video we will be mainly dealing with the patterns of necrosis. So what was necrosis? It was a form of cell death in which the membrane gets damaged and that will result in the inflammation. And then we saw about the characteristic nuclear changes which happened in necrosis, which was pyknosis, karyorrhexis and karyolysis. And microscopically it will be seen as a pink amorphous material. So coming to the patterns of necrosis, the first pattern of necrosis is coagulative necrosis. So this is the most common pattern of necrosis and it happens due to the denaturation of proteins. So when the proteins get denaturated, it will tend to form a coagulum. So this coagulum is formed and that is why it is called as a coagulative necrosis. The most common cause of this coagulative necrosis is ischemia. So whenever there is a loss of blood supply, it will result in the formation of something called as an infarct, and this infarct is nothing but a coagulative necrosis, and it characteristically happens in those solid organs like a heart, then the liver and kidney. Okay, solid organs, whenever there is ischemia, it will result in the formation of these infarcts, which is the coagulative necrosis. But the one exception to this is it is always asked in MCQs, remember, the exception to this is brain. Whenever there is ischemia in the brain, it will result in liquefactive necrosis and not coagulative necrosis. Okay, so why we'll see in a while. So this is the gross image of a coagulative necrosis. This is a kidney actually. So in this, can you appreciate this rest of the kidney is all brownish in color, while this area alone is somewhat white or tan in color, and this is having a characteristic wedge shape, that is like a triangle, and here this triangle's apex will be represented by the obstructed vessel. So that is the origin where the vessel has got obstructed, and then it will form a wedge shaped infarct. The base of the infarct, that is the triangle, will be formed by the base of the organ. So this is the characteristic appearance of a coagulative necrosis, that is an infarct. So infarcts can be of two types. It could be either a white infarct or a red infarct. White infarct will happen in those organs like solid organs wherein there is a single blood supply, that is the end organ blood supply is present. So this happens characteristically in the heart and the kidney. So in red infarct, we can see those organs which are having loose connective tissue. So the organ is not quite compact, or in those organs in which there is a dual blood supply. So in those organs, the red infarct will be formed, the examples of which is lung and liver, both of which have a dual blood supply. So this can be asked as a question. So moving on to the microscopic image of a coagulative necrosis. Here, the most important point of a coagulative necrosis is the preservation of the tissue architecture. This architecture is preserved because there is only denaturation of the protein which happens in the coagulative necrosis. So enzymes which are present, lysosomal enzymes present inside the cell, those are also proteins, right? So those will also get denatured. So in that case, lysosomal enzymes which has to eat up this cell will not be present. It will take some time for the inflammatory cells to come and clear this debris, and that is when the architecture will be destroyed. So that is why in coagulative necrosis, the architecture is always preserved. So can you see this microscopic image? This is an image of a kidney. So this is the glomeruli, and these small structures are all the tubules. So can you appreciate that these tubules are all looking ghost-like, that is the cell, only the cell ghost is present, there is no nucleus present inside this cell. So that is the characteristic appearance of a coagulative necrosis, which appears like a ghost or a tombstone appearance, we call that as ghost or a tombstone appearance. And that is because of the preservation of the preservation of this tissue architecture. So I would like to tell something else also in this. The ghost cells can also be present in a tumor called as pilomatrixoma. Pilomatrixoma is actually a skin adnexal tumor. I am just telling it so that you can correlate when you read about that. where all you see the ghost cells in pathology. You can correlate it like that, okay? So ghost cells can be seen in coagulative necrosis and also in a skin and neck cell tumor called as a pilomatrixoma. And the tombstone appearance again, that again is also present in another condition called as pemphigus vulgaris. Pemphigus vulgaris is actually a skin blistering disorder which is characterized by a suprabasal split. So when there is a suprabasal split, it will result in the formation of something called as a tombstone appearance. So this is the tombstone appearance present. So in tombstone appearance is seen in pemphigus vulgaris and coagulative necrosis, while ghost cell appearance is present both in coagulative necrosis and also in skin and neck cell tumor called as pilomatrixoma. So moving on to the Zenker's degeneration, which is nothing but a type of coagulative necrosis only, but it is seen in a special condition called as a typhoid fever. So in typhoid fever, this special type of coagulative necrosis is called as a Zenker's degeneration, and it characteristically happens in that of skeletal muscles. Skeletal muscles like diaphragm and rectus abdominis. Abdominal muscle, okay. So diaphragm and rectus abdominis will show this type of a coagulative necrosis called as Zenker's degeneration, and this will appear as a waxy or a hyaline condition. So waxy or hyaline, it is nothing but a pinkish amorphous kind of a material. So that is the appearance of a Zenker's degeneration. So moving on to the next type of necrosis, which is the liquefactive or a colliquative necrosis. This happens due to the presence of lysosomal hydrolytic enzymes. So in coagulative necrosis, we saw it was due to the degeneration of the proteins. So the enzymes will also get denatured. But here in liquefactive necrosis, it is the presence of this hydrolytic enzymes which will damage the cell and result in necrosis. And since this cell is getting damaged, it will form a liquid-like consistency. That is why it is called as a liquefactive. Liquefactive means it is becoming like a more liquid kind of a state. And this is seen in those organs which are rich in hydrolytic enzymes like brain, pancreas. So I mentioned in coagulative necrosis also, it happens in ischemia is the most common cause, and it happens in all solid organs except that of a brain. Why? Because brain is rich in this hydrolytic enzymes. So brain, whenever there is an ischemia, it will always have liquefactive necrosis. This is a very important MCQ, so please remember. And pancreas again, that is also rich in hydrolytic enzymes. So there also we can see only liquefactive necrosis. But the most common cause of liquefactive necrosis is actually bacterial infection. So whenever there is bacteria, it will attract the inflammatory cells, right? So bacterial infection will attract inflammatory cells, and those inflammatory cells will pour in their enzymes, and that will liquefy the cell into a liquefactive necrosis. So that is why in infections you always have a liquefactive necrosis. So whenever the organ is becoming like a liquid kind of state, there is no word of this maintaining its architecture, right? So the tissue architecture is not preserved in liquefactive necrosis. In coagulative necrosis, the tissue architecture was always preserved, while in liquefactive necrosis, the tissue architecture is not preserved. So this is the gross image of brain. Here, can you appreciate this? This is a liquid, it is becoming a liquidative state, right? So this is an infarct in a brain actually. So it is an example of a liquefactive necrosis. Infarct in brain results in liquefactive necrosis. So this is the microscopic image of the same. Can you appreciate this is the pink, this material, it doesn't have any shape. It is just like that, a pink amorphous kind of a thing. Okay, and the tissue architecture, you cannot make out what organ is this. It is just looking like an amorphous thing. That tissue architecture is not preserved over here. And surrounding which we see these inflammatory cells, right? So this is the characteristic appearance of a liquefactive necrosis. The tissue architecture is not present, and the inflammatory cells will be seen surrounding it. And the most common cause of it was bacterial infection. Moving on to the next kind of necrosis, which is caseous necrosis. Caseous actually means cheese-like, cheesy appearance. And why does this appear like a cheese? Because those which are rich in lipid content in the cell wall, those will result in the formation of this caseous necrosis. And the most important examples we all know is TB. Tuberculosis is the most important cause of caseous necrosis in our country. And other than that, we can have coccidiomycosis, histoplasma, and syphilis also. All of this can show caseous necrosis. So caseous necrosis is not just for tuberculosis. Other examples also you need to remember. And in tuberculosis, the cell wall contains something called as mycolic acid. So mycolic acid is the lipid which is responsible for the presence of this caseous necrosis. So remember that mycolic acid was the cause of this caseous necrosis. Caseous necrosis is actually the combination of both coagulative and liquefactive necrosis. Initially there will be coagulative necrosis, then liquefactive necrosis takes up upon it. But if they ask one of it, so the most important part of this is the coagulative necrosis only. Okay. This is the gross image of the lung. Okay. In lung, can you appreciate this white structure which is appearing somewhat cheesy? So this is actually a case of a TB lung, and this is the caseous necrosis, the gross image, how it looks like a cheese in a caseous necrosis. So what is the microscopic appearance of a caseous necrosis? This is one of the classical cases you get in a professional exam, MBBS exam second years also. So TB granuloma. There is something called as a granuloma, which is a type 4 hypersensitivity. Type 4 hypersensitivity will result in the formation of granuloma. This is actually a chronic inflammation in which the central part is that of a necrosis. So the central part is the necrosis, that is caseous necrosis, which we see in this tuberculous, surrounding which you have these elongated slipper kind of a nucleus cell. Okay, this nucleus is somewhat slipper shaped. This is called as an epithelioid cell. Epithelioid cells are nothing but these are modified macrophages only. So they have the slipper shaped nucleus which are surrounding this necrosis. And can you appreciate these larger structures, this bigger cell, these two? So these are nothing but the Langerhans giant cell. Remember, it is Langerhans and not Langerhans. Langerhans is some other cell which is a dendritic cell present in the skin actually. So the giant cell which is present in the tuberculosis is Langerhans giant cell, in which you see the nucleus is all arranged peripherally in a horseshoe kind of an appearance. Okay, so that is a Langerhans kind of a giant cell. And also we see there is a collar of lymphocytes. There is a collar of lymphocytes surrounding over here also, can you see? So this is a characteristic appearance of a granuloma, in which we have a central necrosis surrounded by epithelioid macrophages. Then we see the collar of lymphocytes along with the presence of Langerhans giant cells. This is the characteristic image of a granuloma, and this is how a caseous necrosis will also look like. Not necessarily that the necrosis might be present, but I was just discussing about the TB granuloma in which caseous necrosis is present. So this is the pink granular kind of a material. Can you appreciate it is looking dirty and granular? So this is the appearance of the caseous necrosis. So moving on to the next type of necrosis, which is fat necrosis. Fat, the name itself suggests it must be seen somewhere where there is fat is present, right? So breast tissue which has fat and omentum, both of this contain fat. So here, due to some reason, some injury, the fat necrosis is going to happen. Suppose there is a trauma to the breast, or if the omentum, in case of acute pancreatitis, due to injury, what will happen? There will be inappropriate activation of this lipase and other enzymes. So when lipase is getting activated, it will break down fatty acid into fat into fatty acids. So this fatty acids in turn will combine with calcium salts and result in the and this is called as saponification. Okay, fat joining with the calcification is called as saponification, and these two together, fatty acids plus calcium together, they result in these chalky white deposits. Can you appreciate in this gross image these white small dots which will appear like chalky white deposits? These chalky white deposits are nothing but fat necrosis. So this is how a microscopic image of fat necrosis appears. So normal fat will appear like this, while here can you see the fat is all losing its shape. It doesn't look like this characteristic, it is all broken up like this, halfway like this. Okay, and the nucleus is also lost. There is no nucleus over here. Normally the nucleus of a fat cell will have a peripheral nucleus, but here you cannot make out the fat cell is having any nucleus. And can you appreciate there is something blue in color, this basophilic here and there, here again. So this basophilic material is nothing but calcium. Calcium always appears like a basophilic structure in a basophilic amorphous material is nothing but calcium in a histopathological slide. Okay, so this is the fat cells, along with that we are seeing calcium. So this is the characteristic image of a fat necrosis. Remember one thing, we saw that in acute pancreatitis, the peripancreatic fat or the omentum Okay, peripancreatic fat or the omentum will show a fat necrosis, while in acute pancreatitis, when the pancreas itself is getting damaged, it will undergo liquefactive necrosis, because it is rich in hydrolytic enzymes. The parenchyma of the pancreas will undergo a liquefactive necrosis, while the fat surrounding it, that is a peripancreatic fat or the omentum, will undergo a fat necrosis. This is something you should remember and know about. So coming to the next type of necrosis, which is the fibrinoid necrosis. What is fibrinoid? So it happens characteristically in type 3 hypersensitivity. Did we read about any other hypersensitivity in this video? Yes, right. In type 4 hypersensitivity, there was granuloma formation, and that was seen in the caseous necrosis, TB granuloma we saw. So this fibrinoid necrosis is seen characteristically in type 3 hypersensitivity, where there is the formation of this antigen antibody immune complex. Whenever you have an antigen coming, and then that will attract an antibody. So these two together, they'll form an immune complex that is called as the antigen antibody immune complex. So whenever this antigen antibody complex is present, we'll see, take that this is a vessel, okay. So this is the endothelial lining which is lining the vessel. So this antigen antibody complex will come and cause endothelial injury. It will damage the endothelium. So whenever endothelium is getting damaged, it will activate the coagulation pathway. So the end result of coagulation pathway will be the formation of fibrin, right? So the fibrin will be formed, and that will leak out, and it will be seen as a pinkish amorphous material around the vessel. Surrounding the vessel, you can see there is a pinkish amorphous material which is nothing but the fibrin, okay? So fibrinoid necrosis, it is called as fibrinoid because it is fibrin plus the immune complex, okay? Immune complex plus fibrin forms the fibrinoid necrosis, wherein the endothelium is getting damaged because of the immune complex, the result of which is the formation of fibrin which leaks out of the vessel wall and surrounds the vessel wall, and that is called as the fibrinoid necrosis. And it is seen in examples of type 3 hypersensitivity, where and all you can see immune complexes. The most common examples are rheumatic heart disease, then malignant hypertension. PAN is actually polyarteritis nodosa, then malignant hypertension, then in SLE. All these things can actually result in the formation of fibrinoid necrosis. So this is the microscopic image. Can you see the center part? This is all RBCs. So RBCs are present inside the vessel, surrounding which we have this pinkish deposit surrounding all around the vessel wall. This is the fibrinoid necrosis. So this pink material is because of the presence of fibrin. So moving on to next kind, which is the gangrene, which is actually not a type of pathological necrosis. It is actually a clinical term we use in clinical practice. So gangrene can be of two types, a dry gangrene or a wet gangrene. Dry gangrene happens whenever there is ischemia. Most common cause of coagulative necrosis was ischemia, right? So it will actually result in a coagulative necrosis. So this is the gross image wherein you can see the blood supply has been cut off and it is looking quite dry, right? So that is why it's called as dry gangrene. This is actually coagulative necrosis which is happening here. While a wet gangrene is whenever in this dry gangrene there is super added infections, bacterial infections coming. So when I told whenever bacteria comes, it will invite the bacterial the bacterial products will invite the inflammatory cells. So inflammatory cells will pour in their hydrolytic enzymes, and that will always result in liquefactive necrosis. So whenever there is infection, it is always liquefactive necrosis. So in this is the gross image of wet gangrene, wherein you can see there is this pus kind of material, right, yellowish. So this is all because of the bacterial infection. So this is actually a liquefactive necrosis. So in this we had dealt about all the types of patterns of necrosis. Coagulative necrosis, which was the most common type of necrosis. Then it was we saw about the liquefactive necrosis, which was because of the hydrolytic enzymes. Most important example you must remember here is the brain, wherein infarction in the brain will always result in the presence of liquefactive necrosis rather than coagulative necrosis, because brain is rich in hydrolytic enzymes. And again, bacterial infections will result in liquefactive necrosis. Then we saw about caseous necrosis, which was a combination of coagulative and liquefactive necrosis, but the most important of which was the coagulative necrosis. And the classical example was a TB, and microscopically it forms a granuloma. Then we moved on to fibrinoid necrosis, wherein you see the presence of immune complex and fibrin forming around the vessels as a pinkish material, which is the fibrinoid necrosis. It is an example of type 3 hypersensitivity. Then we saw about fat necrosis seen in the fat, wherever fat is present like breast and omentum. Then we saw acute pancreatitis. Then saponification of fat, which results in the formation of this calcium salt appearing as chalky white deposits. Then we saw about Zenker's degeneration, which was again a type of coagulative necrosis seen in typhoid fever. Then lastly, we discussed about gangrene. So that is for today's class. Now, in the next video, we'll be learning about apoptosis in detail. Thanks for watching. If you like my channel, then consider subscribing, and you can also share it to your friends who might also benefit from this video. Thanks for watching.